Hi, I'm Dr. Lisa Banist, dermatologist in Los Angeles, California, and today I want to talk to you about how to heal acne on sensitive skin. People with sensitive skin have a more difficult time in addressing their acne because most of the products that we use for acne can dry the skin and make it red and inflamed. If your skin gets irritated easily and red and chapped, then you will not want to use products that maybe contain vitamin A or salicylic acid or benzoyl peroxide. But there are prescriptions that your dermatologist can give for you that will help acne on sensitive skin. First of all, we can use some topical antibiotic lotions, and we'll want to use the lotion base rather than the gel because the gel is more alcohol based and can dry the skin further. The topical antibiotics will help kill some of the bacteria that resides on the surface of the skin and in the pores, and thus can help with the acne. We do have the option of oral antibiotics as well for people with more severe acne. We don't want to use this on someone with mild acne. But if you're getting pimples and your skin is very sensitive, then we might want to go with the oral antibiotic. For individuals who want to stay away from an oral medication, there are some other options such as homeopathic pills. Homeopathic pills help your body heal the acne on its own, so it just is an enhancer of healing. Finally, I like to recommend omega-3 fish oils to my patients with sensitive skin and acne because it is anti-inflammatory and helps to reduce the sensitivity of the skin. Thank you for watching. I'm Dr. Lisa Banist, dermatologist in Los Angeles, California, and these are ways we help to heal acne on sensitive skin.